And I think, Avery, if you're ready, I think I'm going to kick it over to you for the next 15 minutes, if that works.
Absolutely. Thank you.
All right.
Would you like me to share my screen or?
You can share if you'd like.
Okay. I don't really know if we'll need much slides. They're really just something to look at. I want this to be more of a conversation where we can ask some questions and talk a little bit more about Spencer and how we could support some of your beneficiaries. I can start off and say I'm Avery Pasch. I work for Spencer Health Solutions, and I'm excited to have the opportunity to come and teach you guys a little bit about what we do and how we can help your beneficiaries. So starting off, just to get a gauge of the room, and I apologize for background noise. I'm at a conference right now, so you'll have to bear with me. I stayed as far away from the dog petting station as possible so that barking dogs didn't get your barking dogs going. But in your beneficiaries or in your life or yourself, do you know anyone who is on 3, 4, maybe even 5 medications? I see Brad. Yes, Amy, Megan. And it's frustrating, right? Have you seen that sometimes there's issues with keeping track of what's been taken and when you take it, and titrating? If 1 week you're taking it twice in the morning, once at night, and the next week it's once in the morning and once at night. Have you seen any issues and stress caused there, either for the caregiver or the person actually taking the meds? Okay, I'm glad that we're all living the same life. So that's why Spencer Health Solutions was created. Basically, the goal here was to, instead of just once you've gone to the doctor, plopping the medication and treatment into the person's hands, the caregiver's hands, and they have to figure it out and now, lead the way themselves with no medical training. Instead, we've actually made it customer focused. So rather than the patient going to the pharmacy and getting, say, those 5 amber bottles, instead, everything would arrive at your home. They would get a Spencer device, which is already programmed from the pharmacy to say which pills are taken when and what's the schedule. And that device would alert the person, hey, it's time to take your medication. You click dispense, and instead of having to go and figure out, okay, 2 from this bottle, 1 from this, or dumping out your pill organizer, or God forbid, the Ziploc baggie, it's just a little pouch. And the pouch says, morning 1 of 1 or morning 1 of 2, however their dose schedule is. It has easy open little tab on the top. You rip it open, you're good to go. So that's it. That's Spencer. Through Medicaid, I know that IDD populations, it's actually covered. And I know there's some remote monitoring waivers as well that cover a lot of the price. So it's real simple. I can share my screen so you can see what it looks like. But the refills themselves, it'll say, hey, time for refill. The pharmacy was already alerted. It'd be sent to their house. You click refill. Top opens kind of like a Keurig, honestly. You stick it on the top and it loads itself in, reassesses from the cloud the medication schedule in case there were any changes over the 30, 60 days, whatever it was. And then it just goes on as usual. And if there are questions, you can click connect, and there's a video like this to talk with your pharmacist, your caregiver, your care support team. So say your mom wants to know if you took your medication. She can have access on the app and make sure that you didn't miss a dose, or make sure that you forgot to put in your refill or something like that. So it really helps bring that peace of mind and reduce the burden so you can focus on actually enjoying your life, because I don't think once you get a diagnosis that that should take up 20% of your mental load. People love it. We see, I think it's 98% adherence, 80% people stay on after 2 years. It's great what we've seen people to do. I guess the only other thing to add is if there's biometric readings that are needed, say like blood sugar, heart rate, blood pressure, weight, things like that. Any Bluetooth device connects to Spencer and it's all tracked. So the care team can get on there and see everything that needs to be seen at once. So I can flash my screen and show you what it looks like. But if you guys have any questions in the meantime, let me know while I pull that up.
Avery, Are there specific pharmacies that you partner with, or is it more open-ended and allows the provider to use the pharmacy of their choice? How does that work?
Yeah, so we are currently, whoa. I don't think I've ever shared on Google Meet before. Let me figure out how to change to a different slide. Do you see? There we go. Cool. So we're currently partnered with PharMerica and Centerwell, so two of the largest national pharmacies. And that's currently where, they would have to use those because they do have the pill pouch machine. We're in conversations with a lot of other pharmacies as well. So, if there were pharmacies of interest and you have a connection or you'd like us to talk to them, we'd love to. I know a lot of pharmacies already have that pill pouch packaging system anyway, so it's just a matter of setting it up. Good question. And this is what Spencer looks like. So we've used it in group homes, which is nice because it's tamper proof. You get notifications if someone's trying to get into it or trying to dispense when it's not time to dispense. If you say that they forget that they already took their medication, you can't double dispense on yourself. And it has its own cell tower. So if you don't have Wi-Fi or something like that, it's all connected. I think we have AT&T, I believe. And that's all included. And yeah, it's been tested so that it fits perfectly under your standard cabinet space and things like that. You don't have to pull it out to put in a new refill. So very sleek and not taking up the precious counter space that I know everyone needs for their chopping and prepping and things.
So Avery, would you, in a group setting, you need one per individual if you were, right? Okay.
Mm-hmm. One per individual, and each would have their own app on their phone, and they can provide access to, say there's, someone at that home that works with multiple people who are living there. They'd be able to see all the different dispensers and status, if there's anything missed, stuff like that. So it's really easy. That would be, I think it's technically called like a nurse portal, but it can be any sort of caregiver who has multiple people use the dispenser. Good question, Paul.
Avery, this is Brad. I had a question as far as the portal. So are you able to, I'm assuming that you're able to print off reports, et cetera, from the portal?
Mm-hmm.
What other things can you do with the portal?
Yeah, with the portal, you can see reports on, who is being adherent to their medication, when have things been missed. There are also survey questions that are asked at each dispense, and those can be customized to what you would like to learn about. We do have some basic ones that we utilize, and all that data together, we put through our AI system to help predict, one, is someone going to discontinue their medication? And two, is a medical event going to occur? So, for example, one of my coworkers, his cousin, uses Spencer, and he weighs himself all the time. And all of a sudden, there was a big spike in his weight, which is kind of weird. So they had reached out and said, his care team reached out and said, you should go to the doctor. This is not normal. And fluid was actually building around his heart and lungs. So they're able to catch that faster than, once something is actually starting to impact your health. And now it's a much more serious intervention that needs to take place. And I believe Ben, my my chief data scientist, he also does customized reports and things like that to make it simpler for companies. So whatever needs to be done, he's the guy who makes it happen.
I see you have your hand raised. Go right ahead.
Yes, I apologize if you've already answered this,
Yeah,
but
no problem.
is the dispenser in the US or in Canada? Because I had called
Yeah.
earlier this week and they said that it would be available at the end of October.
Interesting. We're available in Canada, the US, and currently we're working on closing in Australia and the Netherlands as well. So the Netherlands, Canada, and US were all active and already in use there.
Is it active in Arkansas?
I don't know if we have anything deployed in Arkansas yet. I can look into that, honestly. Did you reach out to the website, or who did you speak with?
I called you guys directly, so I spoke to a representative there.
I'll look into see if we're live in Arkansas, but we're all over the US and Canada, so I wouldn't see it as an issue.
Yeah, okay, because she had explained to me that at the end of October, you guys should have a provider here in Arkansas.
Oh, well, I'll check on that because that is good to know. And that would be fantastic for this group if by October we have them ready and running to go. Thank you for the promotion.
We have a couple of, and I'll send out Avery's contact information to everybody afterwards as well for follow-on questions. There's another question in the chat, a couple from Trish. So first one is, what happens when a medication changes mid-month or a medication is discontinued?
And so in that point, that's where something would be sent overnight through the mail. And I believe it'd be up to the pharmacy's discretion. So it may be they give you a amber bottle or it's already pouched, but it's sitting outside the device and it's something to remind you for. But at any point you're able to, pause dispensing if there is an issue with the medication, safety or changes or things like that. So you can, the pharmacy can go in and stop dispense.
Yeah. We're in the same place. Apparently, we're on the same.
Sorry for the background noise.
Are you like have a booth?
And then the other one
You
is from Trish. If a person's going on a trip or go home with family, can pill packages be dispensed early for a week of travel, or do they have to take the whole
When you
machine?
go up the escalators.
Absolutely, great question. So that is the meds on the go. I briefly touched on it, but I didn't really explain. So we have basically an app that goes with Spencer. So Spencer's main thing, it being there as a real reminder, sitting on your counter making the noises. But the app itself, you can go in and say, I'm going to be away from the home for however many doses, and click pre-dispense, and you'll be able to dispense however many pouches you need. And then your phone will notify you, and I actually have the app on my phone. It notifies you when it's time to take your medication. You can't snooze it, just like you can't snooze Spencer. And you can click, took medication, and those survey questions will also show up on your app as well. And any other Bluetooth biometric screening or biometric readings that you have. So heart rate, blood pressure, weight, blood sugar, things like that. Oh, and there's one other thing actually. We do fall assessments as well. That's been really big in the Netherlands. I think there's a fall awareness week in the Netherlands. So we've actually been able to reduce the rate of self-reported falls in homes by looking at medication age, how they're answering the questions, the biometric readings, and kind of predict the risk that people have of fall so that their care providers can step in and have conversations or provide additional supports. Hopefully before that fall happens, because once you have a bad fall, it's such a huge detriment to your overall health.
Avery, I'll sneak one more in. So it looks like there's a video screen, and I think you referenced video. So how is that frequently used? Do providers use that for video verification of a dosage, or is it just for check-ins? How does that typically get used?
So both. If you do want to do video, hey, let me see you take your medication, you can. I personally don't recommend it because I think that makes you feel really like a patient in your own home. Like now I have someone who's checking on me, making sure it takes away that autonomy of your own life. So it's possible. I don't recommend it. The major use for that video screen is whenever you have questions for your care team or your pharmacist, you can click set up time to call, and then you can have video calls either on Spencer or on the app itself.
Okay.
And everything is certified, secure, firewall approved. I have a whole slide of every single regulatory and security approval we have all over the place. So well done and dusted there.
Great. All right, we've got
Any other questions?
Couple minutes left. Are there any other questions?
Is everybody excited? Do you see how this can be used with your beneficiaries? I know, it's so great. I started working here in July and it just feels so much better doing something where you really know, hey, I'm making someone's life better and actually improving their overall health. So hopefully we can work together. My email and this will all be shared by Paul. And I look forward to getting to know y'all. So thank you so much for your time. I'll
Thank
go
you,
pet some
Adrian.
puppies now.
Thank you, Adrian. Thank you for being accommodating on the schedule change.
Oh, of
Adrian
course.
was going to present at last Thursday's speaker series, which got canceled, and she was able to accommodate us here. And so appreciate you being flexible with that.
Yeah, no problem. Thank y'all so much. Have a great rest of your week.